Your Excellencies, distinguished guests, ladies and gentlemen, dear friends, it is a great pleasure and an even greater honor for me to address the event campaign organized by the New Sunshine Charity Foundation, echoing the Thalassaemia International Federation's May the 8th International Thalassaemia Day theme of Be Aware, Share, Care. TIF is grateful and impressed with the planned campaign, encompassing essential components including community-directed awareness, blood donation drives and policy-related advocacy. This reflects the goals of the campaign indeed, targeting to sensitize every involved and relevant stakeholder and decision maker and bring to the forefront their responsibilities and commitments towards improving and extending existing policies, and at the same time developing new necessary disease-specific ones. The ultimate goal being the promotion of equal access of every individual with thalassemia in the country to quality health, social and other care, to share experiences amongst patients and their families, to share knowledge amongst healthcare professionals, to promote awareness amongst the community at large, and to ensure that decision makers and competent authorities acknowledge and recognize the value of effectively controlling this disorder, which, if left unaddressed or even suboptimally treated, will inevitably lead to significant medical, public health, social and economic repercussions. It will lead to premature death of the patients and immense pain to their families. TIF is very well aware of the great philanthropic work that is undertaken by the New Sunshine Charity Foundation in various diseases and across many components and aspects of their care, some or many of which may be directly or indirectly related to thalassemia condition as well, including the management of a bone marrow registry, health technology assessment and support of the specialization of medical students to become pediatricians and their continued education with scholarships and fellowship programs, promoting incentive mechanism in Quang-Ki, Qinghai province as an example. Moreover, making drugs that are absent from the health insurance reimbursement list available to clinicians with financial assistance programs, both for the patients themselves and their families, is another major contribution. In general, focusing on programs supporting the medical expenses of patients with serious illnesses, such as blood disorders, constitute indeed some of the key contributions of Sunshine Foundation to perhaps the most vulnerable individuals in society, who are indeed patients with chronic, complex diseases such as thalassemia. An impressive part of its work is also the focus of the Foundation on the survival improvement of patients with severe, life-threatening disease through the collection and presentation of patients' real-world data, and its urgent efforts on addressing unmet needs, mainly through policy advocacy work, sensitizing governments, enterprises, and charitable foundations to contribute. Ladies and gentlemen, distinguished guests, as TIF, we have worked for many years with the government officials in the People's Republic of China, but also with involved healthcare professionals, patients and their families, particularly across the 8 southern China provinces, where the prevalence of this disease is high. And while prevention policies have advanced through the years and are still making significant progress, well-organized reference medical centers for the clinical management of thalassemia are still largely absent. While epidemiological work and micromapping are quite advanced in the southern provinces, due to the absence of national registries, actual patient numbers cannot be provided reliably, and there is, to date, very poorly published information on the survival, morbidity and mortality rates of patients with thalassemia in these provinces of high disease prevalence. The absence of published or reliable official reports of the age distribution of these patients, for example, across the southern provinces, does not give us the safety of assessing to any length the progress and achievements that may have taken place with regards to the medical attention given to this disorder. This is despite the huge progress made in developing the standards of care for addressing these disorders across the world, leading to impressive survival, quality of life and social integration of patients with thalassemia in countries and regions, particularly of the southern European countries of the world, where these are practiced within the national healthcare systems, as well as the huge current and more recent advances that have been made in the area of care, but also cure of this disorder. The People's Republic of China is a country that TIF highly admires for its huge scientific research advances and competence, and also for the government's support in these achievements, as well as for its efforts in bringing about huge healthcare reforms, including universal health coverage, a goal since 2009, albeit TIF to date lacks information on whether these reforms have indeed reached and covered the needs of patients with thalassemia across the country. Ladies and gentlemen, thank you for giving the opportunity to Thalassaemia International Federation to be part of this very important initiative of the New Sunshine Charity Foundation, and congratulations on this great occasion, and for which TIF would like to firmly state its undivided support. Dear friends across the globe, more than 70% of the thalassemia patients are deprived of their basic human rights for decent health and social care. Patients with this disease are still deprived in large numbers of safe and adequate blood, safe, effective and continuous supply of key medicines, the chelation drugs, multidisciplinary care and psychosocial support. And these are elements that are indeed essential in addressing effectively a complex, multi-organ impacted genetic disorder such as thalassemia. Let us continue to work together towards taking patients with this disease out of misery, pain, disappointment, poor health, poor quality of life, and social exclusion. I am certain that in this prestigious audience you all agree that patients under such conditions have their basic human rights hugely violated. And China is a country that has both the humanitarian approach, the general interest, and the genuine interest for its people's well-being, but also the scientific research and medical competency to achieve great progress in this area, in the lives of these patients and their families. And philanthropic foundations such as the New Sunshine Charity Foundation are indeed and unequivocally invaluable partners in this journey. Thank you very much for this opportunity.